Doctor, what is the difference between a bridge and a dental implant? This is one of the questions I get asked most often. The short answer is this. A bridge uses the natural teeth next to the missing tooth we want to replace. An implant, on the other hand, is an artificial titanium root placed directly into the bone where the missing tooth used to be. In some cases, a bridge is the best choice. In others, an implant is more conservative. There is no single situation that works for everyone. There is only the right solution for that mouth and that patient. The decision is just as important as the execution. Hi, I'm Enrico. I've been a dentist for 47 years, and with these videos I try to explain some aspects of dentistry that patients are often not told about. Now I will show it to you with a very simple drawing. I will show it using this panoramic drawing without teeth, where I've reproduced only some of the teeth, the same ones that you'll see later in the X-ray I'm gonna show you. Now let's zoom in on this area. Here we have two situations. In the upper arch, two teeth are missing. In the lower arch, only one tooth is missing. Here we could make a 3-unit bridge replacing the missing tooth. Alternatively, we could place an implant, an artificial root drawn a bit roughly here, and replace only that single tooth. In the first case, we have a bridge, which I'll draw in yellow. It consists of 2 crowns on the adjacent teeth connected to the replacement tooth. 3-unit bridge. If instead we decide to place an implant, we have a single tooth fixed onto the implant, which acts as an artificial root. Single tooth implant. As you can see here, there is already an apical lesion. And now the X-rays. As you can see here, there is already an apical lesion on this tooth. So it is not an ideal candidate to be covered with a crown and to become a pillar. In this case, it would certainly be better to start with the idea of inserting implants. Since the gap is rather wide, it will be necessary to place 2 implants, one here and one here, so we can place 2 teeth in the area. I've drawn them a bit flat, but you get the idea. This is the use of implants. In this other case, however, the teeth are healthy. This one is also vital and perfectly healthy, even though it has filling. Depending on the quality of that filling, one could decide to preserve the tooth completely and place an implant in this area instead. This implant becomes the support, an artificial root that carries a tooth just like a natural one. For example, I myself have an implant like this. If instead we decide to make a bridge on natural teeth, we would not place the implant. We could cover this tooth with a crown, making it stronger, add the missing tooth, and then either crown this other tooth as well, which is already a bit damaged, creating a 3-unit bridge with a cantilever element. This can be a good solution. Alternatively, if we want a bridge supported by 2 pillars and this back tooth were intact, we might crown this one instead. For example, if this tooth had a problem such as a cavity, we could crown it. In that case, we would have achieved 2 goals with one treatment. We improved the condition of 1 or 2 nearby teeth and replaced the missing tooth. So remember this. A bridge uses the natural teeth next to the missing tooth. An implant uses the bone where the missing tooth used to be. Neither option is right or wrong. The clinical situation should decide, not fashion and not the price possibly. Even in apparently similar cases, understanding the difference is already a form of prevention. In general, understanding is the base of your safety.